Hi everyone, welcome back to the Profession series. For episode 2, I want to go over the strength and conditioning specialist profession that we find within exercise science. I will be doing this video a little bit differently today. I'm hoping that it helps. I want to have a PowerPoint slide as well as a visual of myself running at the same time. I think it will help to make some of the points a little bit more clear. Also, I know I said in the inaugural video that I wouldn't talk specifically about specific certifying agencies, but I think it's actually going to be a little bit better if I do. I don't want to promote or endorse any specific agency over the other. I just think that it will help students and employers and just everybody get a little bit more familiar with the agencies and the certifications that are out there. Of course, if anyone has any questions, they can always put them down in the comments, and of course I'm more than happy to answer them. But I think we'll get started with this video and hopefully it'll work out pretty well. Alright everyone, so today for episode number 2 in the profession series, I want to discuss the strength and conditioning profession. I'm not going to go really in depth on it, but I do want to go over the very, very basics. So again, students can get an understanding, employers can get an understanding, and even the general population can just be accustomed to some of the terms and phrases that we see within the profession. So if we go to the National Strength and Conditioning Association's website, we'll see this definition that you see up on the screen. Now, I'm not going to go and read it all. You can do that whenever. But this comes right from the nsca.com. A strength and conditioning specialist is a health and fitness professional that has received a degree and has become certified to work with athletes to use what they have learned, the acute and chronic responses of exercise, to help athletes really achieve improvements in performance and really to act as an injury prevention specialist in a way, because what your strength coach is going to do for you, whether you're the head coach looking for a strength coach or you're an athlete who's looking for a strength coach, they're going to help you basically get stronger, faster, and do it in a way that is safe and effective and will help you in reducing your risk of injury. There are a few different certifications that you'll find in this field. I'm going to tackle just the ones from the NSCA today. These aren't the only ones that are out there, but certainly some of the more prominent ones you'll see. They're up on the screen there. You can see the abbreviations and what they stand for. I see that I left out a parenthesis there. But your first two, your Certified Strength and Conditioning Specialist and your Certified Special Population Specialist. I put those two up there with the arrow showing you that you will need a 4-year degree for one of those. Could be a Bachelor's of Science, could be a Bachelor of Arts, doesn't matter. I'm going to get into that in the next few slides, actually. You'll see Certified Special Populations Specialist, which is very similar to the ACSM's Certified Exercise Physiologist, which is something I'll go over in another video altogether. So note for the Tactical Strength and Conditioning Facilitator, you do not need a 4-year degree. So let's dive into some of those. Eligibility requirements. So this is big for students who are looking to, they know they want to take CSCS, or even if they don't know, if you want to just get prepped ahead of time, and also for employers, or for if you're a parent of a student that wants a private strength and conditioning specialist. You don't want to go through a team strength and conditioning specialist. This is good information for you too, because this is going to tell you what this strength and conditioning specialist who got their CSCS, what they had to go through. So what they did have to do is they did, number one, need a bachelor's degree or higher from an accredited institution. And that's going to be really important as I go through all of these videos, particularly for you professionals and employers or anyone that wants to utilize one of these professionals. Always, one of my biggest pieces of advice is always look for a certification that is accredited. And always look for a degree program that is accredited. Now you can see there that do you need a degree in exercise science? No, not necessarily. If you come out of school with a degree in physical therapy or in chiropractic medicine, that also checks that number 1 box that you see up there. You will also need a CPR and AED certification, and obviously you'll need to pass both the scientific and practical sections of the exam. So in order for you to become fully 100% certified, you have to meet all four of the criteria that you see up on the screen. One note I should say is that let's say you are a student and you are in your last semester of your degree. If you're in your last semester and you have your CPR and your AED certification, you can sit and you can take the exam. If you do that and you pass both sections, what will happen is you will become what is called provisionally certified, which means that you are certified, but they are waiting for completion of your degree, which I believe has to be done. I think it's within sometime between 6 to 12 months. The NSCA certification handbook can, you'll be able to find that in there. But that are your requirements for the CSCS. Now, moving on to your certified special population specialist. So the criteria here are a little bit different. So if you see a number in front of it on your screen, that means you have to have it. Okay, so number 1, you have to meet at least one of the following. So either you must have a current certification such as CSCS or NSCA Certified Personal Trainer, or some other NCCA accredited personal trainer certification such as the ACSM, or I believe ACE is another organization that has accredited personal trainer certifications. You need either a bachelor's degree or higher from an accredited institution in exercise science or a related field. The NSCA handbook might have a little bit more in this. I do not know off the top of my head if something like an athletic training program would meet the qualification for this area right here. I don't know, but certainly physical therapy or chiropractic medicine, or a current license as a physical therapist, assistant, or athletic trainer. So actually there's the answer right there. If you're a certified athletic trainer, that meets the criteria for number 1. So for number 1, you do not need all 3. You just need one. Just one of those. On top of having either of these, any one of these, you also need your CPR and AED certification, and you'll need some practical experience. Training individuals from special populations, such as a geriatric population, adolescent population, pregnancy, that's a special population, or those who may have a medically controlled disease. And then, of course, you'll also have to have a passing score on the exam. So those are the eligibility requirements for your CSPS. So if you see that after someone's name, you can know that, oh, okay, they've gone through at least this in order to get to that certification. Now, for your tactical strength and conditioning facilitator, this is kind of a different one. This is for those who are looking to really train with firefighters, police officers, active military, things like that. So it's a little bit more specialized, really, than the other ones, because it's a much different set of practical applications that you're going to use. But if you see a TSAC after someone's name, you know that they have gotten themselves specialized in working with, again, firefighters, active military, active police, anything in that sort of realm. And these are the minimal criteria that you'll need. You see them up on the screen. You need all 4 of them. All 4 of them. You have to be 18 years old. You must have a high school diploma or equivalent. You must be CPR AED certified, and you must have a passing score on the exams. So those are some different certifications from the National Strength and Conditioning Association. So again, I hope this video talking about just the very basics to strength conditioning, how to get into them, what the certifications are, I hope it was helpful. Remember, strength conditioning specialists are going to be individuals who are going to work with athletes or special populations for improving performance or reducing risk of injury, so injury prevention. Something I didn't say before, strength conditioning specialists, they can work in a university setting, for a team setting, at any level. It could be high school, it could be college, it could be pro, semi-pro, it could be Olympic level. So any of those levels. And you do not necessarily have to work in the team setting. You can very much, like a personal trainer or exercise physiologist, you could be sort of an independent contractor, and you could have your own private facility where you train athletes. So those are all legitimate possibilities for a strength and conditioning specialist. Another thing I didn't say is your strength and conditioning specialists, your exercise physiologists, they will have some knowledge, some training within the nutrition realm, which is probably the highest and sort of trickiest overlap that we as health and fitness professionals have. Usually, what I caution other professionals and those looking to utilize these professionals is that, we, even myself, I've given you guys my credentials. I've had a lot of experience in nutrition, still not an area that I'm comfortable talking about my athletes, my students, and other professionals with, because it's very tricky. We can give very basic guidelines and recommendations. We can help with reading food labels and things like that, but we are not here. When I say we, exercise physiologists, strength and conditioning coaches, even clinical exercise physiologists, we are not here to prescribe or give specific diets. We don't really do that. What we can do is help with dispersing what are called your macronutrients. So your carbohydrates, your proteins, your fat. What we can do is help to, I'll say manipulate, for lack of a better word, to manipulate those macronutrients either to help with your sports performance or your recovery or your injury prevention, or to help, let's say, reduce cholesterol or blood pressure or something like that. So again, I hope this video talking about strength conditioning as a profession was helpful. I'd like to do more in the future. We'll hopefully bring in some of my colleagues who are certified and work in strength conditioning at different levels. So hopefully you guys can talk to them. All right, bye.